It's whatever it's around of the cell that could create changes in it that would mean a different way of expressing a gene.
Okay. Hi, your host, Danny Ross. Today we have a very interesting topic, integrative medicine. Did you hear about integrative medicine? On my case, I never heard about it until the day I met that beautiful lady, Claudia, and then she told me about that. So I'm going to introduce you to Claudia. Claudia, thank you so much to have accepted my invitation.
Thank you so much for the invitation.
Yeah.
I'm very glad I am here.
Yeah. So if I was asking Claudia to introduce herself, who is Claudia?
Well, my name is Claudia Matos Miranda. I am a medical doctor and a geneticist. I'm a health and wellness consultant. I've been trained in medicine in Peru, and I did my training as a geneticist here in Montreal at McGill University. And I did my training in traditional practices, in India.
Okay.
And also through my career as an integrative medical physician in Peru, I did also get some more training on this.
What is, tell us, for us, we like people, anybody, we never heard about integrative medicine. What would you say? What is it?
Integrative medicine is a different approach. It's an approach that involves the combination of conventional medicine and the use of complementary medicine tools. It means tools that come from traditional medicine for which we have scientific evidence.
Okay.
So integrative medicine is something that now conventional medicine it is practicing. It's somehow new. Nowadays, the most renowned hospitals in the US, for example, and in some in Europe, have departments of integrative medicine.
Okay.
All to say that integrative medicine has been, in most of the cases, has been born into the oncological departments in some of these hospitals, because the idea was to help patients to either reduce the quantity of pharmacology that they take, or to use different tools that would help them get better soon, right?
Okay.
And obviously, when we are in an oncological setting, this is very important.
Oof, yeah.
So that's why they developed this. It involves, as I said, the combination of what we do in conventional medicine and the practice of certain tools that most of the time come from traditional medicine, but we already in conventional medicine, we have tested it, knowing that it is secure and that it is efficient.
So you heard the first time you told me actually was in Montreal about integrative medicine.
Yeah.
Yeah. So you went to India.
Yes.
Okay. So tell us about that's how after you kind of mix the approach of medicine scientific and then the approach of more natural.
Yes. My life in India, because it was for some time, allowed me to get in touch with some Ayurvedic practitioners. And also, after some time, I had the possibility of being trained as a Hatha Yoga teacher. Actually, it's an Isha Hatha Yoga teacher by Sadghuru, from Isha Foundation. He's a very well-known guru.
Yes.
And I was trained there. It was a very long training. So during the training, we learned many different ways of helping people, not only with the yogic practices, but also we learn about, how important it is, food and all that stuff. Things that I had already seen with the other traditional medicine practitioners.
Yeah.
This allowed me to combine, right? So over the last 10 years, I've been practicing medicine, including these practices that I learned. And also during my training, I was able, and also over the last 10 years, I was able to identify which are the best practices or yogic practices that go along with certain diseases. Because it is very important to know that not all practices of yoga are for everybody.
That's interesting to know, because we all do, not all, but I've been doing yoga many years, and I did not know that there was some kind of exercise eventually were not right for me.
Yep.
So that's what you learned in India with Sadghuru.
Yes, and also through the years, I've been, requested to assist some of the teachers that do the classes of yoga. And through that, we were able to collect information that would allow us to understand that sometimes there are certain things that shouldn't be done depending on certain conditions.
Yes.
And also we know that as much as not every practice of yoga is for everybody, not everybody is for every practice.
Exactly.
So that was very good to learn, to understand, and nowadays that's what I use to also help people when they have to be, treated with a condition.
Okay. So you spend most of your time in Peru.
Yeah.
Do you have your own cabinet? I don't know how you say it in, in French, sorry.
It's a consultation office.
Do you have your own consultation office in Peru?
Yes.
Yes.
Well, in Peru, over the last, I would say 4 to 5 years, I've been I was a public servant. I used to work for the government of Peru. I was the director of complementary medicine of the country. So I was able to also not only organize, but also, train different people on this. I was also the manager of complementary medicine of the Social Security of Peru. And due to this, I was the director of complementary traditional integrative medicine for the World Health Organization Collaboration Center that we have in Peru. So that gave me a lot of opportunities to not only get information, do some research, and also created programs. We created a program during COVID where we included the use of yoga as therapy to decrease anxiety. Especially at the beginning, we were working mostly with elderly people that were afraid of going out to get vaccinations. But then later we created a program to work with all the workers. After that, we also created systems in which we could include in the medical practice guides how to include the practice of yoga and meditation to decrease anxiety in patients with chronic disease. That was done with the Ministry of Health of Peru. And at the same time, over the last 10 years, I've been working as a medical doctor. I have my practice in a private hospital in Peru. This is Clínica San Felipe. That's where I see my patients. And that's where I run the health and wellness service. So we see patients there. We take care of patients with oncological disease, with mental health problems, and immunology disease. I would say the most of them are this group of patients, but we see everybody. Actually, anybody can actually take this service.
But you told me too that you have some patients online sometimes because they know you, they know what you practice. So how did you get these people from nearly all over the world?
I have patients, obviously most of my patients are in Peru. Even when I travel, I see my patients online from Peru. And from people from abroad, what I do give is counseling. Because obviously each country each patient in each country will have their own medical doctor.
Of course.
So what I do is sometimes people approach to me because they want to understand well what is their disease.
Yeah.
Sometimes they don't know what is happening to them. Sometimes they don't even know why they're taking a medication. So I listen to them. I explain to them. I counsel them. How important it is also to take their medication, because sometimes people come to integrative medicine thinking we're going to take out their medication, and it's not the situation.
Yeah, that's you know, a kind of some very esoteric people thinks like through you know, yoga or natural you can. Sometimes you can, but sometimes you can't. Sometimes you need a medicine.
You need medication, and it's true that we have complementary tools that would, as the word says, complement the treatment, but it doesn't mean that it's going to replace the treatment. So when people come, I listen to them, I explain to them what is the situation, I counsel them how important it is to take the medication, but also explain, sometimes they don't know why they are taking it. So when they understand, it's like, oh, that's why, right? And then we can add up other practices that would allow them to get better, right? For example, some practices of yoga meditation, or also we do some psychotherapy, things like that. Obviously, we don't do like big psychotherapy sessions. That's to the psychologist. But we cover everything and explain everything that could be affecting them. Because one of the things that is very important when it comes to integrative medicine is that it also takes on account the epigenetics of the person.
I'm going to cut you right there, because when we were talking, you talked to me as a doctor about genetic and epigenetic. So could you tell us in a short way what's the difference between genetic and epigenetic?
Okay, well, genetics, as we know, it's whatever we inherit, right? We take it from parents to kids, and it's a DNA. And depending on that, we may actually have predisposition to generate a disease. But epigenetics is, the word epi means on top. So it's what is on top of this that would create changes in the way how we express certain genes.
So you mean the surrounding?
It's whatever it's around of the cell that could create changes in it that would mean a different way of expressing a gene. This is very important when you develop cancer or when you develop certain chronic diseases. So just to make it easier and not go into the details of the technicality of this, because epigenetics can even be like, you know, the study is a super big field. There is PhDs on this.
Long story.
Long story. Just to make it easy for the people who's listening to us, is everything that could be affecting your life. Everything that you eat, everything that you inhale, your relationships.
Your stress at work.
That's the most important one. That's when all these tools of meditation and yoga plays a big role, because meditation and yoga has proven scientifically that helps people decrease anxiety. So in any ways, no matter which condition we have, it would always be helpful, right? But it's not only that, we also need to check, and that's what we do in integrative medicine. We check what is happening with the food, what is happening with the relationships. And as I said, when I see people abroad, what I do is I help to understand, and also it helps them to be able to go back to their physicians and explain, you know, what are the things that they really want and need.
So if people want to get in touch with you, tell our listeners where they can.
Well, there is a page for me on Instagram and on Facebook. You can find it as Dr. Claudia Matos Miranda. Obviously, most of my information is in Spanish, because it's most of it's for my Peruvian patients, but we will find some more information in English and stuff like that. Also, sometimes I put some things in French, so some people can read about it. Also, you can find me at Mandapam, which is a health and wellness center for which I work.
We will write it.
Yes, we will write it there. And obviously, for people who is in Peru and they want to go to Peru, or they are, obviously I'm at Clínica San Felipe in Lima.
Clínica San
San
Felipe
Felipe.
in Lima, in
Yes.
case you go to Peru.
Yes, why not? You
Why
should
not?
come.
I've been there already,
Well,
but I would like to go back.
Yeah. We do also.
Yeah.
I mean, Mandapam offers retreats to Peru, so
Yeah.
we can actually come and do many things there.
So Claudia, I feel more intelligent now. I know more about. So, but you know, we're going to escape my question.
Oh yeah.
You know what is it?
Yes, I know.
If there was a message you want to leave,
Yes.
you know, short but very precise
Yeah.
message you want to leave to the people who are listening to us, what
Yeah.
is it?
I think the most important is to be open. You know, for many years we thought there is only one way of treating disease, and it's very interesting. If you go and talk to one group, they will tell you this is the only way. You go to another group, they will tell you this is the only way. Integrative medicine actually understands that there are many different tools that we can use, and if we can study them and prove that they are working, why not to use them? My message to physicians, to health practitioners is to say, you know, there are traditional tools, tools that come from traditional medicine for which we have evidence that is efficient and that is secure. Why not to use it? And for the general public is physicians always will be looking for the wellness of their patients. If they are saying to take a medication in a certain way, let's follow it up. It's not that people is trying to harm you or anything. Yes, there are other tools we can use, but it's very important to follow, especially the security of what you're taking. Every time you take something, make sure that you know what you're taking it. Same way how you want to know what happens when you take a pharmacological medicine, also when you want to take another thing. It's very important to question that and make sure that you're always secure.
Okay, so you got the message, eh? It was clear. So thank you, Claudia, it was nice. And you, my listeners, don't forget to subscribe, because thanks to you, I can go on sharing the life of people and learning new things. So it's all thanks to you. So don't forget to put a little like and subscribe. Ciao.
Thank you.